Okay. Hello, everyone. Good day, good evening, or good morning, whenever you are tuning in to listen to this. Today, we are talking to Valerie McLeod. My name is Tanya, and I am a hypnotherapist. Valerie is my colleague. We work together at Ivanhoe Clinic, and Valerie also works from Albert Park Clinic and on Zoom. Why we're here together, the objective is really to show off Valerie. She's a beautiful, very experienced, highly skilled clinical hypnotherapist, ITT therapist, and ISET integrated therapist. So today we really want to concentrate on that part of work that Valerie is doing as an ISET integrated therapist. Valerie will tell us a little bit what ISET therapy is. Maybe we'll start with that, and then we'll move on to ask Valerie about what kind of clients she's seeing and how they can benefit from this kind of therapy. Welcome, Valerie.
Thank you, Tanya, for that lovely introduction. Good to be with you.
That's great. So ISET integrated therapist, the kind of therapy that we are introducing today might not be familiar to a lot of people. ISET integrated therapy. Could you please explain what it means?
ISET stands for Integrated Self-Empowerment Therapy, and it was developed here in Mount Waverley, Melbourne, Victoria, by a beautiful woman by the name of Eileen Goble. And I had the pleasure of being invited to study under her tutelage in a small group back in the early 2000s, 2002. So what ISET is, it is not a well-known therapy. I'm not sure of who else at the moment is providing this therapy to clients. But I decided to take up the invitation to study with Eileen because I was looking for something to help clients sort of get there a little faster, a little quicker, rather than the client-centered talk therapy. So what ISET does, it uses metaphors. It also uses a number of different well-known therapies. Example would be color therapy, gestalt therapy, Jungian, psychodrama, CBT, just to name a few. And so the purpose of ISET is to uncover any belief system that may be affecting our feelings, emotions, behaviors, and our health. So the metaphors bypass the conscious mind into the subconscious mind, which, as we know, the subconscious mind never sleeps, so it records everything. It's a very safe and very gentle practice that Eileen had a GP that used to say, it's very unassuming. It's very gentle. My clients remark on wonderful transformations in a very short space of time.
Yes, thank you for introducing this therapy, which might not be familiar to a lot of people. And you say that it's working with the subconsciousness.
Yes.
Is it right?
Yes.
So we're going into the space where information comes in a way, in a form of metaphors.
Yes, metaphors, yes.
Metaphors.
So the client doesn't know what the metaphors are, but me as the therapist, as I said, I've been trained by Eileen. I've been practicing this a very, very long time. And clients are amazed at the end of the first session how differently they feel because of those metaphors. And through those metaphors, I can tell them exactly what's going on for them. And as we go, it is transformational. So in the first session, not only do we uncover the origin of where this belief that is affecting them, we also transform that belief. To the end of that session, it works in a series of 3 sessions per issue. But yes, it's very, very effective. And I've been helping a lot of people with ISET.
So you've been working with ISET for over 20 years, and you have seen a lot of clients with different complex issues.
Yes.
So what sort of issues do clients come to you with?
Well, it sort of seems to come in themes, which is interesting. At the moment, I have a lot of phobia people. So there's particularly a lady with a dog phobia. She's had it her entire life. She's now walking dogs. So it was a two-part phobia: dogs on leads and dogs off leads. So she's very comfortable with dogs on leads. She's now back enjoying walking with her girlfriends, walking, talking, and with the dog. She had a lot of anxiety, a lot of stress around that. The other's food phobia. Recently had a couple of people who had phobias from when they were 4 years of age. Also needles. I had a lady come to me. She was going in for some surgery, and we were able to uncover that it wasn't actually her belief, it was her mother's belief. And so I'm also able to give strategies around those sorts of things as well. I had a beautiful man through the pandemic that had complex PTSD. He had 3 sessions. He actually has written a beautiful testimonial for me, which appears on my website at selfempowermentcoaching.com.au. I've had people come just to check whether there is anything going on, and it also shows no, there was nothing going on. They're fine, and they can get on with their day-to-day. So it is very varied. And the clientele are of all age groups. I've even worked with children quite successfully. So it does vary on what is disrupting their life.
Just talking about phobias, when they come to you at the beginning, they probably exhibit a number of different symptoms that they believe are connected to this phobia. Phobia is a fear, right?
Yes.
Uncontrollable, unconscious fear. What are the symptoms that they are coming with? What are the things that they're burdened with?
Anxiety, stress, feeling out of control. Their body can freeze, heart palpitations, clammy, sweaty, just an array of things that just, they freeze, and all sorts of things are going on in their body. Their muscles tense, even get headaches, nausea. So there's an array of different emotions, feelings that surge. They actually surge through their body in that moment. And as we know, Tanya, as therapists, is that emotion will always win over logic. And even though some of these clients logically know this is silly, this isn't going to hurt me, whatever it is, particularly like with food, it's food, it's good for me. But the feelings, the emotions will always win over that logic. So it's also helping them to see that as well.
So going to the origin of this emotion, say if it's a panic or if it's anxiety connected to this phobia, do you ask them to imagine things? Do you ask them to look inside their body for any felt sense? Both, yeah?
Yes, so do both. So there is a metaphor for releasing these emotions, which is very, very powerful. And that's a process within itself. And once they go through that process, there is an immediate change. I also like to check in with their body as well. And that's why the healing of the color therapy So it's a very thorough process, and it works on every aspect of the psyche. So it's very important for them to release those emotions that are limiting, to deal with that limiting belief, but also to check on their body if it needs any healing or if there's anything else stored. It's not about reliving, it's observing. So no one, I've had some clients that, have had a lot of things happen to them in their childhood and growing up, teenage years and early adult years. They don't need to relive anything. They just need to observe. They're perfectly safe and they get all the information, but then we deal with that information. So wherever it may be sitting, how is it showing up in their lives? And we go about repurposing those limiting feelings, emotions, and the belief.
So when they come to you in the first session with all these symptoms that show up, and what are the benefits that they receive at the end of working with you? What can they expect? What kind of transformation?
Well, they can expect transformation. I have not had one person that has not had a transformation. It has been designed very cleverly by Eileen Goble that it does work. As I said, it takes 3 sessions. At the end of a session, most people look different. And I always get them to go and have a look in the mirror, because it's just a joy for me to see that person transform before my very eyes. They often report of feeling lighter. They yawn. They can have symptoms in their tummy. So there's a whole heap of symptoms that is a trigger to me that I know because they've shifted, and sometimes they've shifted a lot. And they just say to me, I just feel really different. I feel very, very different. Some say I can't put it into words. Some just, I feel lighter. I feel resolved.
Yes.
Yes.
And this is amazing to create a different kind of experience inside their body. So we're so used to feeling a certain way,
yes,
to be a certain way. And unless we create those different experiences for our body, for our nervous system, we're not able to shift just mentally, trying to unblock or analyze or even write down or talk about the problems. Really, we have to work in conjunction with
absolutely
the whole human system.
Yes, because I always check in, because if someone has had a particular belief that's been holding them back for a long period of time, well, it's another part of the process is that we can address that limiting belief, but we also have to install something purposeful that the client is wanting to replace that old negative belief. And also too, it depends on how long a person has had a certain, I'll call it thing, but it's learning. It's learning these new feelings, because the feelings can be very new for some people. They've never had them before, or they had them when they were a child and then felt robbed of those feelings. So there are strategies also of how after a session to keep the client centered and very focused on the work.
And in terms of time, how long does one session go for?
I ask people to allow 2 to 2.5 hours, because invariably some parts of the session, because it's bespoke, it's for that client, it's not a generic process. So sometimes we need to spend more time in a certain area than others. So I like a client to allow a good 2 to 2.5 hours where they can just have that time just for them to be able to come in and just confidently and comfortably deal, without being rushed for time, to address the limiting beliefs.
Right. This is great. Maybe next time we can talk in more depth about phobias, for example.
Yes.
I am very interested in phobias myself. I would love to have a session on phobia. I have my own little secret phobia, which I'm not going to tell you about right now. But once I get a session from Valerie, I'll be able to come to you here and report back about my experience. Yes. Hopefully this is in the near future. Today, well, thank you very much, Valerie. And Eileen Goble, Valerie introduced me to Eileen Goble. I got her books, and a very interesting, unique lady, worked as a psychotherapist.
Yes.
She was a channeler as well. She was closely working with spirit guides and energies. So very open-minded, and because of that, and also talented, and because of that, she was able to achieve great results with her clients. If you are interested, go check her out and just make that little connection. What a giant she was, and she still remains a giant, because from beyond she's able to reach back to us and actually pass on information, right?
Absolutely.
That's partially why we're here, and we'll be talking more about ISET and really reintroducing it back into the place of its origin, because that's where it was born, that's where it belongs, and if it has a way to grow, it will be growing from here. And I know that this particular therapy is going to grow. It's got a huge spiritual backup, and Valerie here is the face of it. Okay, so please keep an eye on Valerie. She's amazing, hugely talented, immensely supported in the spiritual world, especially. And you want that kind of support because you want the support of the spirit. It's not just physical and emotional anymore. We have to utilize all parts of us, all aspects of us, as holistic human beings and spiritual beings, energetic beings. So it's not now, 2023 coming is not the year to say I'm just this or just that. We're coming to the space and time when we are everything, right?
Absolutely.
Yeah, that's great. And I would invite you, please check out Valerie, her website. We'll put it in the link here. And Valerie also offers a gift today.
I do. I've also had a few clients come through with the issue of lacking of confidence. And that confidence stems back to issues, again, that have happened in childhood. So I've put together a 12-minute audio for people. If you just head to my website, selfempowermentcoaching.com.au, that is my gift to whoever would like to listen to that recording. It's only 12 minutes and 12 minutes out of your day. I hope you like it.
Yeah, I listened to this recording, hugely delightful and uplifting, and Valerie's voice can take you to beautiful places in your body and in your mind. So this recording will be just people can listen to it any time of the day, or would you recommend it for them to listen before sleep, or any recommendations?
I would highly recommend just before sleep. If I have had a couple of people say that they've been very distracted before sleep. So I said to them, well, in the morning, any time that you can, but it is highly recommended to listen to it just prior to sleep. It is, as I said, only 12 minutes. It does have a little bit of background soothing music to it. So if you do happen to fall asleep, that's okay too, because your subconscious mind will still be absorbing my words.
Oh, that's beautiful. Yeah. What a wonderful gift. Thank you for it. You can find the recording on Valerie's social media and her website. Thank you so much for coming out talking to us. And I hope we can see you again, maybe after my little or big or normal phobia session. Yeah.
Be my pleasure to do a session with you, Tanya. And then, as you said, you can come back and report to the group.
Oh, that'd be great. Thank you so much. And thank you everyone for listening and liking us and following us. We appreciate your attention and your interest. Thank you, Valerie.
Thank you, Tanya.
Okay, bye.
Bye.